My name is Krishna Sayam, and in this video, I'm going to walk you through the fundamentals of the US healthcare. My goal, once you complete this video, is to make sure you will have a fair understanding of the basics of US healthcare and you would understand the terminologies. These are the topics that will be covered in this video. We'll cover the basic definition of healthcare, the types of care. We'll understand the key stakeholders in the US healthcare. We'll understand the definitions and terminologies around the members, the providers, and the payers. We'll talk briefly about the workflows around the patient and the claims. We'll understand the types of payers. We'll talk in brief about the US regulations and mandates. Now let's start with the definition. The standard definition of the healthcare is nothing but the prevention, treatment, and management of the illnesses to ensure the physical and mental well-being of an individual. Coming to the types of care, as we see here, they are primarily classified into the primary, secondary, and the tertiary care. In addition, we have the home care services. So the primary care refers to the first point of consultation. This is like visiting your primary care physician or a family physician to avail the medical services. Now, as you move along from primary care to tertiary care, it indicates the severity of the illness would increase. The secondary care is when you visit the providers for an urgent care or an emergency care. Tertiary care is when you receive any specialized care where you get admitted, you go through surgeries and all. And the last one, the home community care, is where you receive the home care or the community services, and these include the nursing homes, the community care centers, and all. Now let's talk about the stakeholders in the US healthcare, and this is also one of my favorite topics, and also it's really important to understand the stakeholders and how they interact with each other in order to understand the workflows of the US healthcare. So I'm going to talk about the individuals first. So an individual is someone who is buying an insurance plan from the payers, or it could be the employers whom the individuals gets employed. They buy the insurance plan from the insurance companies, and in a way these individuals or these employers, they pay the premiums to the insurance companies depending on the plans they buy. And also there are taxes that would go to the government in the form of the payroll that gets deducted on a monthly basis or from your paychecks. And the government in turn would pay for the government programs like the Medicare or Medicaid to the insurance companies. Now, the consumers or the patients are at the core of this workflow. An individual becomes a patient or a consumer when he avails the medical services. Like, say, for an example, there is a person XYZ who had an insurance plan. Then, on one fine day, he has to visit a provider. Then he becomes a patient. So he then visits a provider. So a provider could be a clinic, a hospital, or a physician, or a nursing care. Then the provider would look at the patient, he diagnoses the patient, and then if any care is needed, he would take care of that. And once the patient leaves the hospital or the clinic, post the services are done, including any lab or radiologies, the claims then go to the insurance companies. And a claim is nothing but a bill that the provider would send to the insurance company for the services availed by the patient. So this is one scenario wherein the providers would pay for for the services done by the payers to the insurance companies. Now this part, the self-pay, is when the patient has to pay the bill themselves, and these could be the cases where the insurance does not cover the services as consumed by the patient, or these could be cases where they don't have any active eligibility. So those are the cases where the patients has to pay the bill themselves to the insurance companies. And then we also have the pharmacies or the pharmacy benefit managers, wherein the providers, for any e-prescriptions that are needed, they normally send it out to the pharmacies from where the patients would collect. We also have the PBMs, called the pharmacy benefit managers, in between, who kind of coordinate the pharmacy benefits for the providers as well as the payers. Now let's understand in details of the definitions that we just went through. The consumers or the patients, these are the primary stakeholders in the US healthcare. They are the ones who receive the services or who consume the services provided by the other stakeholders. The providers. So a provider is anyone, an individual or an entity or an organization who is providing the services to the patient. And the providers would normally diagnose and provide services to the patients, and they get paid for the services that they provide. Now, this could be a provider, could be anyone like a hospital, it could be a facility, a clinic, a nursing home, or a home health. So, all of these would fall under the provider category in the terminologies of the US healthcare. Next, the payers or the health insurers. So, these are the health plans from whom the individuals or the employers would buy the insurance plans, and the payers would pay for the services availed by the providers, and they pay these services based on the contracts or based on the benefits that are on the agreement. So a payer could be an Aetna, could be United Healthcare, or a Blue Cross Blue Shield, from whom you buy the insurance plan. Employers or the groups, so these pay to the health insurance the premiums. In most of the cases, people get employed with companies, and the companies would in turn take a group insurance, and they pay the premiums on behalf of the individuals, and then the individuals get their payroll deducted in the form of a premium. And most of these employers would again have contracts with the payers in order to avail the group insurance. And then the government also plays a key role. Uh, they would determine the type of health insurance to be provided to the uninsured. We have plans like the Medicare and Medicaid that are formulated by the government in the US. They also formulate and maintain the regulations and the mandates. Example, HIPAA is one of the key regulation which we'll talk about in the upcoming slides. Then we have the clearinghouses or the third parties. So these are the intermediary or third parties who helps with the administration or processing the admin activities on behalf of the payers or the providers. So most of these clearinghouses in the industry, they help with checking and scrubbing the claims, and ensuring the payments are passed across between the payers and the providers. One of the example of the clearinghouse is MDON, who receives the claims from the providers, who does a basic check of those claims, and they convert them if needed and send it out to the payers. And one of the type of the third party or a clearinghouse is also in ASO, which is an administrative service organization who takes care of the claims administration on behalf of the payers. All right. Since we have went through the basic terminologies, let's talk about the patient workflow at a very high level. Now, a member who has got an insurance plan, they call up the provider to get an appointment. Let's say their appointment is scheduled, and then on the day of the appointment, they visit the hospital or the facility. They go to the front desk, and the front desk will check them in on the day of the appointment, and then the doctor sees the patient. He understands the diagnosis. He does the documentation on the patient chart with his diagnosis, what problems he has, and if there are any tests to be done, the provider would order them. Say, for example, a patient comes in with the abdominal pain, and the doctor has to order radiology. And in some cases, there could be blood test that has to be ordered to determine to basically determine the diagnosis. And then the tests are done, and then the lab or the radiology would send back the charges to the billing system, and they also send back the results to the EMR. Now, once these charges go into their billing system, then the billing system would generate a claim in the form of an electronic format, which we call it as EDI. So that claim sends over to the insurance company. The insurance company will then determine the claim. It will decide the payment to be processed depending on the contracts. Then it sends the payment back to the provider, and the payer would also send something called the patient statement or an EOB, which is the explanation of benefits that tells what services were availed by the patient. All right. Now let's go deep into the definitions. So, who is a subscriber and who is a member? A subscriber is the primary policy holder who holds the insurance plan and is also responsible for making the payments in the form of premiums. A member is an individual who is covered under the policy held by the subscriber. It could be the spouse, it could be the children, it could be any other dependents. And a subscriber is also a member on the insurance plan. Now, let's say this is the member or subscriber primarily. His name is John, and John is the primary policy holder who took an insurance plan from a payer. Now, by default, John becomes a member, and also John is the subscriber. He's the primary policy holder. Now, John has, say, three dependents: his spouse, his two kids, who are also now the members on the plan as dependents. We need to understand the primary difference between a subscriber and a member, that a subscriber is the primary policy holder and anyone who is a dependent becomes the members of this policy holder. And by default, the subscriber is also a member on the insurance plan. All right. Providers. So who is a provider? As I just spoke in my earlier slide, a provider is an individual healthcare professional or an organization who has the license to provide the healthcare services. A provider could be a physician whom you go to, a primary care or a family physician, it could be a clinic that you visit, hospitals or facilities, or any physician groups, the nursing care, the rehab centers, the ambulatory surgery center, or any other uh, providers who provide the services. All right. So basically, the types of providers, as we see, it's the PCP, the primary care physician, who is your first point of entry into the healthcare system, and we also normally call them as your family doctors, your general practitioners, or the PCPs. Specialists are the one who are specialized in certain degrees or areas, and the PCP normally refers you to a specialist if you need to see them. Like example, you go to your primary care, and then your primary care thinks that you will have to visit a specialist, maybe a terminologist, maybe a cardiologist. Now let's understand some of the terminologies on the provider side, which are like most often used. EMR, or the electronic medical record. You must have heard the provider systems or the EMRs like the Epic, the Cerner, the Allscripts. So all of these provider systems at the core maintain these electronic health records or electronic medical records, and it's nothing but a digital version of the patient's record within that EMR system with the provider. That's where most of your data goes in. They pull up your chart, they will enter the problems you came with, your diagnosis, what tests were ordered, what results came back, your history, and all other patient details goes in there on your medical record. Next, the problems, diagnosis, or the conditions. So these are the problems or the conditions the patient comes with or the doctor diagnoses. So all of these data goes into your patient chart on the EMR. For example, a patient with the diabetes mellitus type 1. So this goes as your one of your condition, and any other diagnosis the doctor determines. Order or a test. The test that the provider orders in order to understand any additional diagnosis during the visit. It could be a lab order like a blood test. It could be a radiology order like an ultrasound. Then RX slash prescriptions. These are nothing but the medications or the pharmacy prescriptions as prescribed by your provider. Then the appointments, visits, or encounters. All of these are used synonymously. This is nothing but any visit or any encounter by the patient to the provider. And then the allergies, it's straightforward, like any item that the patient is allergic to. For example, the patient is allergic to peanut butter, that goes under the allergies. And then the procedures or the services. Any service as provided by the your provider for each of your visit goes under your procedures or the services. It could be your initial consultation, it could be a clinic office visit, or it could even be your lab test. All of these are nothing but the services provided by your provider. Now, let's understand the difference between an inpatient versus outpatient, or what they really mean, because these are the terminologies you would come across a lot if you are working on the clinical side of it. Okay, so as it says, inpatient uh, refers to anyone who needs medical care that requires a hospitalization. And inpatient care is provided in a hospital or any other inpatient facility where you are admitted, or you are spending, you spend overnight, or you spend more than 24 hours. An inpatient can also be referred to as IP or IPD. An outpatient, it refers to, someone who requires medical care but without any hospitalization. So we'll have to understand this key difference. Outpatient doesn't require you to get admitted to the hospital. However, inpatient would require you to get admitted to the hospital. An outpatient department or outpatient clinic is for the treatment who visit the hospital for diagnosis, but you don't need to get admitted as such. And the outpatients are also referred to as the OP or OPD. This is nothing but the outpatient or the outpatient department. So we just understood the main difference. So this is key. We'll have to remember what's the difference between these two. Now let's look at a basic use case. What happens on a regular day? So let's take this scenario. Mr. John, who is aged 35 years, works for a company ABC, and the organization has a group insurance from a health insurance company in Boston, Massachusetts. The company deducts, say, dollar X amount, maybe $300 amount, example, for the medical plan from the monthly paycheck, and in turn, that company pays the insurance company a monthly premium to cover for the healthcare services. Now, Mr. John, on one fine day, he's suffering from a chest pain and he's having a persistent dry cough. So he visits an urgent care center, there's some name given nearby his place. Then the front check, uh, it's actually the front desk. They verify John's health insurance and they check them in. Then John pays a co-insurance, which is a percentage of amount as part of his health insurance plan. We're going to cover this terminology in the next slides. And then the doctor examines John and confirms that it's gastric, and he prescribes, say, antacid tablets. And then this urgent care center, once the patient leaves the hospital, they will generate a bill and they will send a bill to the insurance company in order to get paid for the services that they have provided. That's what happens next. So your provider facility that you visited, that urgent care center, is going to send a claim to your insurance company. Insurance company examines the claim and they send back the payment to this urgent care center. Now let's understand some terminologies of the payers. The managed care, those who are in already been in healthcare must have understand this terminology. So what's a managed care? So these are the companies that offer benefits by having a contract or a network with the physicians and hospitals. So basically, these insurance companies would tie with the physicians or the hospital groups in order to provide uh, insurance to the companies. And the policy holder, basically the subscriber who gets subscribed to that insurance plan needs to choose one of these network physicians to get the services done. So these services or these plans would come in different plans. We call them as HMO plans, PPO plans, and POS plans. So these plans normally differ in the way you can choose your providers. Otherwise, in a nutshell, in managed care, there is a network and you will have to choose the providers who fall within that network. Medicare. So Medicare is a federal program that provides benefits for your care, your medical services, and other expenses to people who are 65 years or older. There are more to the criteria. We're gonna cover that in the coming slides. In contrast, Medicaid is a federal program, federal state program that provides benefits for individuals and families with low incomes and resources. The commercial payers, these are the private for-profit insurance companies who provide the health insurance to individuals or the groups, and a person can directly purchase the coverage directly from these insurance companies. However, the normal setup is that in most of the cases, the employers or the groups would buy a group insurance for their employees. And these commercial plans would allow the policyholders to choose any physician and hospital and receive the reimbursement after the expenses are incurred. All right, some more terminologies of the payer. A medical plan. So this is a plan as purchased by the member or the employer from the company. It could be a medical plan, it could be a dental plan, it could be a vision plan. Now under medical, as we have seen, there could be multiple different types of plans like an HMO, PPO, or a POS. Okay, benefits. So what are benefits? So these are nothing but the when you take a insurance plan, you will get some benefits that gets covered by this plan. So the benefit would tell you what are the services that you can avail from your providers. A benefit could say it would cover the clinic visits, it would cover the hospital's admissions for a specific provide services example. And when you buy an insurance plan, you would get a detailed summary of what benefits would be covered by that plan that you have taken. So the provider contracts or the provider agreements. This is nothing but a legal contract or a legal documentation between a payer and the provider and the services that they sign up for. Now, this is very important when it comes to processing the claims because if a provider has a contract with the insurance company, they would mention in that contract what are the services that the provider is going to provide for the members or the patients. If the patient avails any services that is outside of this agreement, they normally don't get paid. Now, these terminologies, the copay, coinsurance, and deductible, are most commonly used when it comes to the benefits or the claims processing side of it, and even on the clinical workflow, wherein a member becomes a patient, he goes to the hospital. There are these uh, amounts that they will have to pay. So let's understand what copay is. A copay is nothing but a fixed dollar amount that a member has to pay for each visit. Now again, this depends on how the contract is laid out. and depend on what services you are availing. If your contract says that for each visit to a primary care physician, you will have to pay a $5 amount of a copay. That's what goes in. You'll have to pay $5 for each of your visit. And if the contract says that you will have to pay, say, $10 for your visit, then copay becomes $10 in that scenario. Now, before we get to deductible, let's understand the coinsurance. Now, in contrast to a copay, a coinsurance is the percentage of the cost that you will pay after you meet certain deductible. Like the coinsurance could be like you will have to pay 10% of your cost that you incur after you have met the deductible. That becomes your coinsurance. Now, what is deductible? This is any amount the member has to pay before the insurance company starts paying for a given benefit year. For example, if you have taken a medical plan that has a deductible of, say, $1,000, and you get admitted to a hospital, say an individual gets admitted to a hospital and he stays for, say, 1 week in that hospital. The initial $1,000 of the bill has to be paid by the member themselves, post which the insurance company would start paying. Let's say you incurred a bill of $5,000. The first $1,000 has to be paid by the individual. The remaining $4,000 gets paid by your hospital. On the same lines, as I mentioned, coinsurance is what you pay after your deductible has been met. It could be like a percentage of the cost, total cost. Like in this case, as I mentioned, out of, say, $5,000 of bill, there's a deductible of 1,000, and then on top of that, you'll have to pay 10% of that $5,000, which is a $500. All right, some additional terms. We already covered the deductibles. Let's talk about the limits. So what is a limit? It's any limit that's on the member's benefit. It could be a limit on your number of visits. It could be a limit on the dollar amount. A simple example could be your benefit plan might say for a specific service, you might be able to avail only 3 office visits in a year. In that case, you would have a limit on the number of visits. Or say there could be a limit on the dollar amount on a specific service. If you incur that dollar amount already within that benefit year, then you normally would not get paid on top of that amount, which you will have to pay out of your pocket. So what are the claim forms? So when a provider sends a claim to the insurance company, it has to go in a format. Earlier it used to be the paper forms, but now everything is electronic, which we call as an EDI format. So as the definition says, this is a form that the provider submits to the insurance company in order to get paid. Currently it's the electronic version that goes out. We call as an 837 the claim, and the payments is where the insurance company would pay to the providers for the services that they avail. It could be in the form of a check, in the form of a electronic transmission, which we refer as 835, electronic payments or remittances. All right, let's talk about the claims workflow in general. What happens end to end, starting from a member calling up the provider for an appointment, through the provider getting paid from the insurance company. So the workflow starts with the member scheduling an appointment with your provider or your hospital or your clinic. Then he visits the hospital, he checks in, Then the doctor or the physician examines the patient. He does any diagnosis or the test, and then whatever tests were performed, as we seen earlier, the charges would flow into your hospital or the billing system. Okay, now until here, this becomes more of a clinical workflow wherein the patient comes to the hospital, he gets the services done, and the patient leaves, right? What happens after the patient leaves the clinic or he leaves the hospital? So that's where the backend processes would get triggered. Now there could be multiple services that the hospital or the clinic has provided, right? So they have examined the patient. Let's imagine this scenario. The doctor has ordered, say, a lab test. He has ordered a radiology test, right? In that case, those charges or whatever services were availed will have to get paid. Now, how do these charges would eventually get sent to the insurance company, right? So for each of these transactions that was done, there could be different radiology and the lab systems that gets used in that hospital. So each of that system for that specific patient would send out or trigger a transaction in the form of a charge that goes into your hospital system. The radiology would trigger one charge for the patient visit, the lab would trigger another charge, and the physician would trigger the charges for his basic physician charges. So all of these transactions would go into your billing system, and they get tied against that uh, patient encounter or the visit. And then the billing system would then consolidate, it would identify for that specific visit what are the different transactions or the charges. It consolidates them, creates a single claim, and then it converts that claim into a format that has to be sent over to the insurance company. So as I mentioned earlier, it's the electronic format that the claim has to go into, which is your EDI X12. So your hospital or the billing system would take care of that. If not, they also use a third party called the clearinghouse who would convert their claims into an electronic format. So your hospital or billing system would then generate a claim, an EDI format. So that claim would go through a clearinghouse, or it could also go directly to the insurance companies. In most of the cases, they use the clearinghouses who does a basic check, syntax checking and errors before sending it out to their insurance companies. So that 837 goes out either directly or through the clearinghouse to the insurance company. So once the insurance company receives the claim, what happens? So again, there are different processes within that insurance company who would examine and run to make sure they are paying for the as per the contractual, you know, uh, agreement between the payer and the provider. So the payer would do something called claims processing or claims adjudication. So this is a process that would examine each of the claim. It will make sure the the basic checks like the member is active, the provider is on the contract depending on the plan. They would check whether the procedures that were availed were they part of their agreement with the providers, and they will make sure the services are medically necessary. And once that adjudication process or the claims process is completed, the output of that would be whether the claim has been approved or whether the claim has been denied. So if the claim has been approved, all well, it goes into the system as approved. It then generates a remittance or a payment advice. If there is an issue with the claim, or if, say, for example, the member is not active at that point of time and they had to deny the claim status goes as denied. And there are cases wherein the payer would need more information from the provider in order to move forward with the claim. They need to possibly have the payers review those claims for any additional information. So these rejections or the reviews, they have a separate workflow. Again, there are multiple processes within these for claim denials or claim reviews. So those that reports or the data goes back to your insurance company. Then someone from the insurance team, like the claims examiner or the claims reviewer, they will look at the claims to make sure they supply the additional information back to the provider as needed. And in case of denials where the provider thinks the claim should not have been denied, they would appeal on that and they will send it back to the payer to re-examine the claim. So that's basically the workflow that happens. Now, imagining that or assuming that for all the paid claims, the remittances are generated or the payments are generated. So they go back in the form of an 835 electronic format that you see here. Could be directly or through the clearinghouse. So in this path, we are seeing a clearinghouse. The payments or 835s go back to your billing system, and then the billing system would process the payments and they get paid for that. So these payments could be in the form of checks. These payments could be in the form of your uh, electronic transmission. Okay, and at the end, for the claims that gets processed through successfully, the payers would also generate something called a EOB, which is an explanation of benefit or a patient statement, which would tell what are the services that were availed by the patient and how much they have been paid by the insurance company. All right, now let's look at some of the types of the uh, insurance, and we earlier discussed about the commercial. Now let's talk more about the government programs. So if you're already in the US healthcare industry, you would pretty much know what Medicare, Medicaid are and what the differences are. So Medicare is a federal program that provides benefits or services for your hospital admissions, your regular medical services, or any other healthcare services to the people who are 65 years or older, and also people who are under 65 years of age but with these long-term disabilities or end-stage diseases. So some of these are the ESRD, which is the end-stage renal disease, or ALS. So people with 65 years of age or less but with these long-term issues would also get covered under Medicare. Medicaid is a joint program. It's a federal as well as state program that provide benefits for individuals and families with low incomes and resources. And for Medicaid, the federal government will establish the guidelines and rules. However, it's the state who administers this program. And there are a lot of other programs from the government. Like if you look at the state programs, some of these are called CHIP, the Children's Health Insurance Program. We have the federal employees health benefits. We have TRICARE, we have workers compensation, and a lot of other programs. All right, let's go deeper into the Medicare plan. Now, Medicare consists of four parts: Part A, Part B, Part C, and Part D. Now, what does the Medicare Part A cover? This is the hospital insurance. Like if you get admitted to a hospital, These are the services that fall under Part A. So if you see here, it covers the inpatient hospital admissions. It also covers your skilled nursing facility, any home healthcare services or hospice care. All of these fall under your Part A. Part B is pretty much the medical insurance, any outpatient or any uh, doctor visits. And there are certain home health services that would fall under your Part B. A Part C is called as a Medicare Advantage plan. So the beneficiaries who are covered under Part A and Part B, Part C will give the option of obtaining the Part A and Part B coverage through a Medicare approved private sector health plan. So anything that doesn't get covered under Part A and Part B, your Medicare Advantage would give some additional benefits on top of your Part A and Part B, and this is normally administered through the private insurance plans. Part D is for your prescriptions. It's an additional plan that you will have to the Medicare beneficiaries has to take in order to cover for the prescription drugs. All right, what is a Medicaid program? So as we have seen in the previous slide, it's the health insurance provided to people with low income, people who are aged, disabled, and blind, and it also includes their dependent children and pregnant women. Now, each state would administer its own Medicaid programs based on the guidelines as set up by the federal government. And some of the guidelines that each state follows here, they determine the eligibility requirements at a state level, and they will also prescribe the type of services and the duration that should get covered, and they also defines how much has to be reimbursed. So that's where the Medicaid, since this is at a state level, there are a lot of rules and regulations that would change as you move across the states within the United States. Your eligibility, your reimbursement, all of these would vary depending on which state Medicaid program you are availing of. And there is something called dual eligible. This is the population which gets covered both Medicare as well as Medicaid, and they are called as dual eligible. Let's say as an individual you are qualifying for Medicare as well as you're qualifying for Medicaid. So in that case you are dual eligible, and whenever you avail the services, it's the Medicare that pays first, and the remaining bill will go to the your Medicaid. A clearinghouse or the ASO, we have went through this in the earliest slides, but a quick definition of what a clearinghouse is. It's a third party organization which acts as an intermediary between the providers and the health insurance companies. What they do, they pretty much collect the claims from the providers, they perform any basic scrubbing or validations, and then they route it back to the insurance companies. And what do they gain by doing this? They normally charge a standard fee for processing the claims or the payments, and this fee that they charge, it depends on the contracts with the individual payers or the providers. An ASO, an administrative service only, it's an organization that provides administrative services to the insurance companies. So it's the case, say for example, you have an insurance company who doesn't have the ability to process the claims administration. So they normally outsource their claims administration to an ASO, and the ASO in turn would charge an admin fee for each of the transaction or the claim they process, and then they give the results back to that insurance company. All right, so the US healthcare regulations. So this is one important topic, and this is uh, a key given that it's all the healthcare data of the individuals. And also the US healthcare has a lot of regulations and mandates that needs to be followed by the all the stakeholders in the industry. I'll be covering just a few of them here, but as I mentioned, the whole US healthcare is driven by a lot of mandates and regulations. There's a lot of information out there on the internet that you could go and Google in, but I'll cover the key ones in this video. The HIPAA, you must have heard about this. Any person who is working in the US healthcare industry would know this term by default, since this is one of the key training that they would go through even before beginning any of the work. So HIPAA stands for the Health Insurance Portability and Accountability Act. This was introduced in 1996, and there are basically two key categories within HIPAA. Uh, they call it as titles. One of them is to make sure the availability and continuity of the healthcare coverage. So this is to make sure uh, each of the individual would avail of the health insurance irrespective of the pre-existing conditions. And then the other category or the title is the administrative simplification. This is again a bigger topic to go in details, but at the high level, it is to make sure your data is flowing through in an electronic format, which is an EDI that we looked at in the previous slides, the 837s, the 835s, and there are a lot of the transactions that will have to exchange your data. So all of the healthcare organizations should have the ability to be able to communicate data in an EDI format. Then you have got your privacy and security standards from HIPAA that you will have to follow to ensure the privacy of the patient health data, and to ensure your data is secured when you are exchanging the data through your between your different healthcare systems or organizations. And then PHI, given that this is all healthcare data and it's very sensitive and confidential, we have some PHI rules that are built in. There are specific uh, elements of the patient that are considered under a PHI. Okay, some other regulations or mandates. If you have heard about the Affordable Care Act or ACA, or also called as Obamacare, this is a mandate that was brought in to make sure there is insurance for everyone. I mean, everyone has to buy an insurance plan, or they may have to end up paying the tax penalty. It also includes that any employer-sponsored coverage should provide a minimum benefit package. Like there are certain benefits that comes under this category. Those have to be at a minimum provided by your employer. And this rule also brought in the something called exchanges. So we have these marketplaces that someone can go online, whether an individual or an employer group, they can go and buy plans online. So that's an exchange that allows you to buy the plans there. And there are a lot other state and federal programs, like we have the ERISA plan, we have the HMO Model Act, we have the COBRA, and many others. I'm not going to go into these details, but you'd be able to find that information online. All right, so this completes my video. Thank you so much for spending your time going through this video. If you like the video, please do hit the subscribe button. Thank you.